respected chairpersons sitting in the dais and respected audience of the dais. First of all, I thanks APAO Scientific Committee and our Chhattisgarh Ophthalmological Society chairperson Dr. Lalwani sir. They have organized this beautiful symposium on, as we all know, we all are the 60-70%, we are all the cataract surgeon. And for the better results, we need a better pre-operative evaluation, intraoperative, operative and post-operative. As lot of mistake has been created during the pre-operative phase, in which there we faces a catastrophe. So this is the topic on which given to me is the preoperative inattentive catastrophe. As we all know, if a good surgery is done, then the vision is 6-6. So the patient goes with the smiling face and the surgeon also having the smiling face. But if something happens to be wrong, then it results into that catastrophe. That is a very bad, which never a surgeon wants. That is the endophthalmitis. The adequate measures should be taken before any ocular surgery. The aim is to minimize the risk of the contamination and the infections. Preoperative preparations, the baseline investigations, as we know, the blood pressure and the blood sugar, the maintenance of the hygiene, the pre-existing disease, which may be diabetic, hypertension, heart disease, asthma, dental caries, and neurological problems. And there must be clean OT and the aseptic precautions. The baseline investigations, the pre-existing disease, if there is associated diabetic hypertension disease and all allergic condition, these has to be well controlled, and preferably the medical clearance should be taken from the MD medicine if these patients are having these diseases. Then the random blood sugar should be preferably less than the 200 milligram of medical checkup and clearance, as we have already discussed. Then in case of the children, the routine and microscopic urine checkup and the culture should be done. And in case of the orbital surgery, the blood sugar, blood grouping and the BT-CT has to be done preoperatively. Then the topical antibiotic, the broad spectrum antibiotics 4 times, preferably 3 days before, to decrease the bacterial flora, and preoperatively tropicamide every 10 minutes before surgery 3 to 4 times. Then the phenylephrine should be added in case of hypertensive and the cardiac patients. Then this slit lamp examination, this is very important before the surgery to see the lid and the adnexa. The preoperative, the regurgitation test, it should be done 1 day before, and it should not be done on the same day. And if there is infection in the sac, so either the DCR or the DCT should be done, and minimum 2 weeks after these 2 surgery, the cataract operation can be done. The A scan 1 day prior preferably should be done, and one should avoid the contact biometry on the day of the surgery. Intraocular preoperative 1 day before surgery should be done, and it should be within normal range. Then in the operation theatre attire, patient should be well covered. The cap, mask, the OT cloths, and the foot shoes. These are things should be there to prevent the infections. Then marking and the cleaning of the surgical area. The right patient, this is very important. The right patient, right eye, and the patient name and the hospital ID, there should be badge to prevent the interchangeable of the patients. Many times we read in the paper that the right eye was to be operated and the left eye was unfortunately operated. So sometimes this blunder happens, and a big medical legal, not only the medical legal problem, but it is a very bad thing for the surgeon and for the patients also. The preoperative cleaning with the 10% pyridine in the ward should be done, and the identification marks should be there in the forehead, the eye which has to be operated. This we all used to do in the earlier cases also, when we used to do a large camp. Then the shifting of the patient in the OT along with the badges. Then the surgical preparation, we should clean with the 5% pyridine for 3 minutes. And in the high-risk patient of the HIV, HBS, and all these patients requires special attention, and ART should be continue. And then conclusion, importance of knowing various steps in pre-operative period to ensure strict asepsis and prevention of infection, to ensure early and good visual recovery. This will prevent post-operative catastrophe which result in endophthalmitis. Thank you very much.